I'm Derek Greatrix. I'm a local GP and I'm also chair of the South Devon and Torbay Clinical Commissioning Group. I'm talking to you today about one of the new innovations that we brought in recently called the PSA tracker. It is men who have got stable prostate cancer where, as I said, just needs monitoring. They are asked by the consultant when that stage is reached if they would like to go onto this tracker. And what this is it's a computerised program which is run by one of the specialist nurses at the hospital, and patients are given an individualised treatment plan which states what sort of intervals they should be followed up, any further investigations that may be needed at some stage in the future. And this is put onto the computer program. This brings up on a regular basis the men who are needing follow-up, and the nurse will actually contact them by letter and say that they need their blood test. They then go along to their local GP practice for the blood test. The results are picked up by the specialist nurse, and then she will contact the patient in order to let them know that everything's fine. Or if they do need follow-up, she will arrange that for them. The advantages to the patient for this is that they only have to go to their local GP surgery. There's no need for them to come to the hospital and all the potential hassle that can involve. And it also provides a very secure way of actually making sure that patients do receive their follow-up, so that they're not lost to follow-up. Because we know that the specialist nurse, if they haven't had their blood test, will chase them for it. So it actually provides a very safe service as well for patients. We estimated at the beginning that about 600 to 700 men would be eligible to go onto this tracker, and the vast majority that have been asked have actually elected to do so, and we're already up to that sort of figure, and there are more coming on stream. So we reckon that as a minimum this is saving 1,500 visits to the hospital by patients and 1,500 outpatient appointments, which actually is more convenient for patients, as I said, but also frees up resources at the hospital.
Treatment that I've had, which was brachytherapy some 12 months ago, and now noting that I'm now on the tracker is reassuring, because picking up on what you said, reference treatments. Now all I need to think about is a 6-monthly blood test, PSA blood test at my local GP, which, as you highlighted, is a lot simpler to get to a GP than it is to find the hospital and parking and everything associated with it.
I think that it actually demonstrates that you can do things differently, and we hope that we'll be able to extend this to other parts of healthcare in this area, so that people needing regular follow-up will be able to have it in a way which is much more convenient for them. And we hope that the close working relationships that we're developing between the hospital and GP practices will actually continue to bring new ideas like this to the fore, and overall hope that healthcare in this area will become much more patient friendly.